Welcome to #CR Arthritis at the Canadian Rheumatology Association and Arthritis Health Professions Association annual scientific meeting. I'm Maya, and I am the program coordinator at Arthritis Consumer Experts, and I'm also a person living with rheumatoid arthritis. I am joined today by Dr. Tom Appleton, who is a rheumatologist and clinician scientist at Western University. Dr. Appleton, thank you so much for joining us today.
Thanks a lot for having me, Maya. Glad to be here.
So you have kindly agreed to be featured on our program for a number of years in a row now, but for any new audience members, would you mind telling us a little bit about yourself and how you are involved in rheumatology?
I'd be happy to. So thanks again for bringing me back, and always a pleasure to be working with the CR Arthritis campaign. And the last few years, I've actually been the chair of the annual meeting, and so I think got in under those auspices. But this year, I have no such claim to make. So continue to be involved in the CRA, and very happy to be once again working with the planning committee for putting on this year's meeting, but also involved in a number of workshops and just helping with a number of initiatives throughout the year that the Canadian Rheumatology Association is involved with. Some of which are virtual care, some of which are to do with guidelines, etc. So it's a very busy association, and happy to be contributing.
We interviewed you last year. When we did interview last year, it was on the topic of osteoarthritis treatment and care. And I'm wondering if you can share with us any updates or new findings in that disease area.
Yeah, for sure. So it's been a busy year actually in the osteoarthritis research space, as it has throughout rheumatology. Osteoarthritis has been one of the hardest areas for us to make serious inroads, at least from a medical standpoint. And I think there are a few themes that have come out in the past year that are important to highlight. So I'll start with actually non-medical management. There have been quite a few studies that have been investigating whether exercise is a good thing or not a good thing for people with osteoarthritis. And it seems kind of funny that even at this point in time, we're still trying to sort that one out. I think there's an overwhelmingly large amount of literature that shows that exercise is in fact a good thing for osteoarthritis. And it's more that there are certain extremes or certain types of exercise that may not be good for some people. So probably the biggest advancement that's happened this year is now the release of guidelines that, including from the American College of Rheumatology, that say that exercise should be tailored to the individual person. So really allowing people to pick the type of exercise that works the best for them, and that they feel the most comfortable and safe doing, and also enjoy doing, and not to overdo it, to at least get involved and have some sort of activity. Even if it's just 5 or 10 minutes a day, is going to make a big difference for people as opposed to doing nothing at all. Certainly, lack of activity causes people to get worse, and also doing too much of a good thing can also cause more exacerbation of muscle stiffness and these other symptoms, which are just a deterrent for all of us. Let's be honest, to keep exercising. So it's been nice to see those kind of guidelines now coming more into common practice. So I hope those will be taken up and useful to people in practice and in day-to-day life. But on the more exciting end of things, we've been questing after medications for treating osteoarthritis for many, many years. And a lot of clinical trials have been carried out. A lot of resources have been invested. And there haven't been a lot of successful trials, at least until more recently. We've seen actually a few trials now starting to show positive signals. And so, with some cautious optimism, I think there's hope for a bright future over the next 5 to 10 years as we see development programs kind of coming to maturity. There are two main areas that I think are worth highlighting, and one is in the area of pain. There are new monoclonal antibodies that have been studied for actually the past decade to treat pain and osteoarthritis. And those are anti-NGF, or anti-nerve growth factor antibodies. And there's been quite a controversy about them in particular, because it's been shown that even though they're highly effective, it can actually increase the rate of progression of joint damage in some people. It's a small number of people, a small percentage in these clinical trials, but nonetheless, a very important thing to try to understand. So the thing to watch for over the next 6 to 12 months is what the FDA's decision is going to be. There is one molecule called tanezumab that's now currently being reviewed. And so if that gets approved, that'll be a bit of a game changer, I think. And we'll have to wait and see in which patients and at which times that'll be approved for. Perhaps on a completely different note, people have been looking for a long time for a medication that can improve the structure of joints. And there is now a clinical trial that has been reported as positive for improved cartilage thickness. It's a once every 6 month injection of a recombinant protein, so a protein like your body would otherwise normally make, and a higher concentration that can be injected into joints and actually improves cartilage thickness. And it did so over a couple of years. So these are longer term studies that are being conducted, hence why it takes a long time and a lot of resources to be able to do. But it's really exciting to see that there are some positive advancements happening in this field, and I think more to come. So stay tuned for more news on that front.
Wow, all of those items are super exciting. So in terms of what you were talking about with the treatment that could actually get at the joint cartilage, I believe, as you said, would that be kind of similar to the treatments in inflammatory arthritis that are getting at the underlying disease activity? Is that sort of what you mean?
Yeah, I think so. I think it's a good way to think about it. So, we're understanding more about the biology of these conditions, and really, that's so important for our research to understand how the diseases actually occur at a biological level or a molecular level, and that tells us what medications would need to be used to try to help people in that situation. And so, as that knowledge has built up over many decades, we're starting to see now that we can try to replace things that may be missing in people with osteoarthritis. And so that's where these sort of growth factor treatments would potentially be useful.
Right. Great. And then also, like, it's great to hear that there's sort of some more concrete answers now or reassurance in terms of exercising with osteoarthritis. You mentioned that what should happen is sort of a tailored plan for patients. That's sort of the balance between not overdoing it, but getting that activity. I'm wondering, how would a patient go about getting that tailored information? Would it be from a GP or a physio, or are there other resources?
Yep. So that's a great question. And I think the answer is probably it depends on who you're normally working with and who you have access to, because as we know in this really large country of ours, some people have quite different access to healthcare and have different specialists or other providers around them. I would say that anybody who's used to working in a musculoskeletal medicine kind of environment is going to potentially have expertise in this. And we all need to have expertise in how to advise patients with exercise. The most important thing to remember is that exercise is good for us, and it's just a matter of finding a way to do it so that we're able to be active and enjoy the process and not have it be a painful experience. um, you could work with a physiotherapist, you could work with an occupational therapist, you could work with a family doctor, orthopedic surgeon, rheumatologist, physical medicine, and rehab specialist. There's lots of people who could potentially help with this. But I think it's important to actually have that conversation with whoever your provider is. They will know you, they'll be able to listen to you and what your day to day life is like and help to figure out what would maybe work best for you. Really hard to put that all on just a generic website and have one size fits all for everyone. So good to talk to your providers.
Right, thank you. That's super helpful. And speaking about the access to care and how it differs, one thing that's sort of being seen now as a way to potentially improve access to care in some ways is, of course, virtual care or telemedicine. And I believe that you actually chaired a session this morning titled Mapping Out the Future of Virtual Medicine in Canada. I'm wondering if you can share some of your key takeaways from this session.
Yeah, well, that was a real pleasure to be able to work with a panel of experts, of people who've been working with virtual care technology in rheumatology to provide care to our patients in the rheumatology field, even before the pandemic happened. I think it's important to remember that virtual care has long been in development well before the pandemic occurred. And it was almost as though the pandemic needed to provide this sort of impetus or this reason for us to push ahead and actually, deploy some of these tools. And I think in retrospect, it would have been nicer to do it in more of a controlled way, but nonetheless, necessity had us do that. So we had a panel discussion this morning with 6 experts across Canada, coast to coast, in urban settings and rural settings, working with adults and pediatrics and working with allied health professionals as well, really providing their perspectives on what's happening with virtual care. And one thing is absolutely clear: there have been a lot of impacts as a result of virtual care, some of which are really, really good, and some of which are maybe not so good. And hopefully, as we're learning more and more about the impacts on patients and impacts on individual providers and their practices, as well as on impacts on our trainees and how we're training the next generation of rheumatologists for practice, and what's happening to their ability to train, in a more of a virtualized environment. So a lot of impacts that maybe weren't foreseen as much at the beginning of the pandemic. So it was a very interesting discussion.
Right. I'd be interested to know what some of the positive impacts that you mentioned, specifically, which sort of positive impacts for patients with rheumatic diseases have you and the panel members noticed?
Yeah, absolutely. So there were quite a few that were enumerated. One I think that everybody would resonate with very quickly is it's just more convenient in some cases, right? I mean, there are a lot of visits that we have with our patients, say rheumatoid arthritis patient who's been doing well for the last 6 months, coming in for a regular visit, but we know things are generally well under control. They didn't have any major concerns coming in. It's a quick examination and renewal, and away you go. And maybe that's fine if somebody lives 2-3 blocks away from the clinic, but if you live 6 or 7 hours away, in a far-flung rural area, it's the middle of the winter, that's not the most convenient appointment to travel to. So there are clearly some circumstances where having access in a virtual manner is perhaps better, or at least much more convenient than making that long trek or that long distance. And I'm giving extreme examples. Obviously, there are nuances. But I think at the same time, people have realized that there are a number of things that we can do that maybe we always did in person before, but now new care models can be developed so that they can be delivered either by telephone or by video visit, just in the same kind of way you and I are talking right now.
Right. Okay, well then lastly, this is a question that our patient viewers are always eager to hear is, can you offer lifestyle tips or self-management tips for our audience in terms of osteoarthritis treatment and self-care? I know we did talk about physical activity a bit, but if there's anything else you'd like to speak to.
Absolutely. Well, it's important that we always recognize the importance of these lifestyle tips, and I don't think there's a day or even a morning that goes by in clinic where somebody hasn't got this as the main question that they want to talk about, at today's visit. And I would say that by and large, whether it's rheumatoid arthritis, ankylosing spondylitis, psoriatic arthritis, scleroderma, or my patients with osteoarthritis. I mean, all of my patients are asking these kind of questions really about, what should I be doing? What's my lifestyle? So what can I do to improve my microbiome is an interesting question that I've been getting more and more lately. And I think, Tim Spector's work, who spoke at last year's CRA meeting, shows that if we can all eat more plants, we'll all be doing much better in terms of our microbiome. And hopefully that translates into better cardiovascular risk and cancer risk and inflammation risk as well. Len Calabrese also has a lot of great tools available for people who are interested in making dietary modifications, and actually quite a thick booklet that you could access and read very deeply about this if you wanted to. I think more or less it boils down to having a really good diet that can be embodied by the Mediterranean diet. So people eating things that are high in omega-3 fats and rich in vitamins, and again, dark leafy green plants, and these sorts of dietary changes, which are harder for a lot of us to make, especially depending on what food we have available to us in the local supermarkets, but we know are important for us for so many reasons. So those sorts of things. And then of course, activity, which we talked about already today, just move comes to mind. And it doesn't matter what type of arthritis you have, just getting out and even doing a little bit of movement, or even staying in and doing a little bit of movement just for a few minutes a day. It's amazing how much of a difference that can make. So I would say all around, these are really important things that do come up through most visits in some way or another, and are important we don't forget about.
Great. Well, thank you, Dr. Appleton, so much for all of this information you've shared, not only on osteoarthritis, but also virtual care. It sounds like there's a lot to be excited about, and looking forward to in terms of new medication treatments for osteoarthritis. And we'll continue to see how virtual care expands and gets changed to fit exactly patient needs and healthcare needs. And yeah, this is great. Feeling very positive after this conversation with all that is to come. So thank you so much.
And thank you so much for doing this. And so glad that you guys are offering this service to the patient community as well. Always interested in following your work. And thanks again for having me today, Maya.
Great. Thank you.